Kolkata. So thank you all for joining us this morning. With much waste of time, I would like to introduce the dignitaries on stage. To my left, Dr. Virendra Kumar, Chief Operating Officer of HCG EKO Cancer Center. Then we have the man of the day, Dr. Joydeep Chakraborty, HOD, Hemato-Oncology and BMT Unit of HCG EKO Cancer Center. So I would like to request Dr. Virendra Kumar to start the session with a brief introduction.
Of the House and technical team, and Dr. Joydeep Chakraborty, all of us to take out time to honor our invite of sharing the story. A story of success, a story of health, fitness, scientific expertise in the field of oncology, a story of hope, and one of a survivor who has recuperated. More of this, Dr. Joydeep sir will elaborate shortly. Before we do that, I think it's pertinent that I request you on HCG EKO Cancer Center a bit. So HCG EKO Cancer Center is located in New Town, Kolkata, Action Area 1. The landmark is DPS Newtown School. HCG EKO Cancer Center, by the very name, is a joint venture between HCG and EKO. HCG stands for Healthcare Global Enterprises Limited, which is founded and led by Dr. B.S. Ajay Kumar, Chairman and CEO, headquartered at Bangalore, with multiple centers in India and a few abroad as well. EKO is a very distinguished and reputed company on imaging and diagnostic services, which is founded and led by Dr. S.K. Sharma, that is headquartered in Chauranji, and is also a chain of diagnostic centers in Eastern India. The very reason, and a very apt one, the two have come together and we have found as HCG a very good platform, a strong platform, a technically enabled platform, which HCG put together, bringing the best of diagnostics and best of therapeutics and research together in the field of cancer care. We would be elaborating one such story as today. HCG EKO Cancer Center shares the value of adding life to years. That's our vision. And this is to be done by redefining healthcare through global innovation. There are many of the firsts that we have. And at this point I would like to mention the first in India, first in Eastern India, and first in Kolkata, a very strong treatment platform. I'm just recapping. We have mentioned this in 2018. We have the Radixact X9, the most modern and updated tomotherapy platform that is in radiation oncology. So just to mention one of the first that is available in the city at our hospital. Going forward, I would like to mention you why we are a center of excellence. So we have 6 distinguished edges. And the first is comprehensiveness. And I mean the comprehensiveness in the approach of the patient care and not just the facility. So comprehensiveness starting from the screening to diagnosis, to counseling, to treatment plans, to financial advice, to support, to actually treat, to follow up, and then to rehab. I think this is what is the topmost edge that I would like to mention. The second edge is a subspecialty approach. While treating cancer, we do have a lot of other challenges, the comorbidities that patients may have. There could be an endocrinology problem, there could be a neurology, nephrology to mention. All these subspecialties are taken together and new consultations are done so that there is a holistic and a proper and a complete care, apart from the focus on the mainstay. The third distinguished edge is the multidisciplinary cancer management approach through a tool that we have, and we call it the tumor board or the cancer board, where we all come together on a daily basis and also in an organized way with the entire team of 400 plus oncologists participating weekly through various sessions by the name of mobility, tumor boards, cancer boards, recurrence leads, so on and so forth. The fifth, I would say, is technology intensive. This is something that we take pride in, and I can only state that there are many of the first in India and the world that HCG has brought into Asia. And this highly technology incentive, I have mentioned that is at X9 for an example. There is so much more that we can always look at, and within the group, almost everything is available. After that comes the quality of care, the measuring of clinical outcome, and the sharing of the same. So there is a lot of academic work, there is a lot of monitoring of quality. We take pride in publishing our outcomes and sharing it with you, just like we are going to do today. And the last and most important is the rehabilitative and supportive care. So with the 6 edges of comprehensiveness, subspecialty, multi-speciality, technology, quality of care, and a support system, we come out to be truly as a center of excellence, as a standalone, dedicated oncology hospital in the city of Kolkata, for West Bengal, the Northeast, Eastern India on the whole, and the neighboring South countries to benefit. We are in the phase 1 and we are going to grow. The focus is on good clinical care and the importance of that, sharing of the same, so that more and more lives will be benefited. I again appreciate the efforts that you all have made to share the story today that we are going to unfold. My colleague and friend Dr. Jyoti Chakrabarti, Program Director of DMT and Hemato-Oncology, will be speaking upon shortly. And without taking much time, I will now request Shubhadeep to take the program further. Thank you very much.
I'd like to request Dr. Jyoti to carry on from here and take us through the program and give a brief introduction of the things that we do in Hemato-Oncology in our hospital. Over to you, Dr. Jyoti.
Thank you very much. To Bangla English Initiative Bulchi. So thank you, Dr. Virendra, and my colleagues and people of the press for attending this meet. So, apart from the Radixac X90, which is obviously a pride of the Institute, I feel the Institute is being driven by our hemato-oncology work also. And that should have been mentioned by Dr. Virendra, and I'm a little bit disappointed he didn't. But on the other hand, I am here to tell you that we have done quite a bit of work during this pandemic also for patients who, which I might say, we must recognize that being a new center, we are getting patients from places where they have been told that they don't have any other option but palliative care. And some of those cases we have been able to turn around, not everybody, but some of them we have been able to turn around, and some of them are living today being healthy. So I think that is a major accomplishment of our center. And that happens because, as Dr. Virendra said, of the comprehensiveness. আরেকটা জিনিস যেটা দেখেছি যে the quality control of this whole group is commendable. So many of you might know me. I have seen a few known faces also. That I've been in around Calcutta, বিদেশ থেকে ফিরি 2014 সালে। তারপর থেকে কলকাতায় different hospitals like Apollo, Amri, and then coming here. But what I've seen is the quality control and the intent to do good for patients is there. এমন অনেক সময় হয়েছে যে পেশেন্টের সেরকম রিসোর্সেস নেই and the hospital has come in to help. So there is an emotional part of this group also which I have seen, which keeps me intact in this group. And as a team, especially my BMT team, what we have been able to focus on has been the empathy, has been the care with empathy. I think that strikes us apart from any other hospitals or any other institutes. That is the first thing I would say, that আমরা যখন patient আসে, we always think that the patient is one of our family. And I take pride in saying that it is not only me, but all my team members, my nurses especially, you get a much more personalized care, which I feel is lacking in many other hospitals around, not only in India but around the world. So that is something which sets us apart. And obviously we've got the expertise to do all kinds of bone marrow transplants. I would say it's only one other center in Calcutta which attempts to do bone marrow transplants the way we do it, and our success rates are also enviable. So one of the cases that we are going to highlight is also of a very young girl who who came to us who had a very different presentation to blood cancer than what is normally seen. We have taken the girl through her chemotherapy and through to a bone marrow transplant, and now she is, doing well, definitely alive, healthy, and getting back to work and to life normally. So without wasting any time, Shubhadeep, I think we should see it from her itself.
So adding life years. So we would like to share a video with you all where the patient itself will be speaking of her experience and how she was given the new life by Dr. Joydeep and team. So over to you, Pranjal. Can you play the video?
Facing daily basis, but suddenly in the middle of October 2019, a severe back pain was started, and for that reason, I was almost bedridden. I was not able to walk properly at that time. I was visited 2 to 3 orthopedic doctors at that time. They had given me so many medicine. I have taken those also, but none of them was able to identify the actual problem. My condition was deteriorating day by day. Me and my family members were too much worried about my health. At that time, one of my cousin brother, who is associated with a hospital, told us about Dr. Joydeep Chakraborty. Because during that period, I was gone through with so many blood tests where those reports were not normal. And from a common friend of mine, we came to know about HCG EKO Cancer Center Hospital. Without making any delay, we visited to HCG EKO Cancer Center to meet Dr. Joydeep Chakraborty. And after that, I was gone through with some blood tests, and on the same day, it's 10th December 2019, it was confirmed that it's AML, Acute Myeloid Leukemia. It's a type of blood cancer. After knowing that, we were totally broken down emotionally. We were so afraid because before that we never know about the treatment procedure of blood cancer. We had so many doubts. We thought that time that it might be cured or not. Then Dr. Joydeep had discussed all the procedure and the treatment of blood cancer, and he consoled my father that if the proper treatments were taken and if the bone marrow transplant was done, then it might be cured. And finally, 13 December 2019, I was admitted in HCG EKO Cancer Center BMT unit for my further treatment. Before that, I never admitted in any hospital, so that at that time I was really so afraid of. But I came to know that I was wrong. I was totally wrong, because here in HCG I had got a homely atmosphere. Not only in terms of treatment, but here I had got mental support from all the doctors, the sisters and other BMT members. Not only that, I had got really support from the other hospital staffs also. On 16 February 2020, my bone marrow transplant was done, where my elder sister was the donor. In the whole journey, I have got a constant mental support from my family members, my friends, my colleagues, my relatives, as well as from the doctor, the sisters and the other BMT staffs here. And now it's been more than 9 months that I'm free from cancer. Now I'm living a healthy and normal life. Now I can work by myself. I spend time with my friends, and now I'm enough confident that I had fought against the demon cancer. And now I just want to say thank to my family members, my colleagues, my friends, my other relatives for their constant support, and thank you Dr. Joydeep and team and HCG EKO Cancer Center. For them I have got my second life. Thank you so much. Just be positive, be confident. If I can, then you can also win against the demon cancer. Thank you so much.
In the story, and it's due to the pandemic that we are taking precautions, and what I would like to tell here that even in the face of the pandemic and the COVID-19, I am thrilled to say that the expertise and the precision and the knowledge and the skill that the team at Bone Marrow Transplant Department at HCG EKO has shown, especially the nursing under the aegis of Dr. Chakrabarti, and we have associate Dr. Mandal also available, the fellowships that they carry out, the knowledge that we have and we are sharing, that has developed a very personalized nursing and a personalized care program. So what happens is that the patient, if I may, stays for very long duration. And the nurses are throughout morning, evening, night, and they have to be very, very careful in diagnosing and working together with the doctor and understanding if there is an emergency or any sort of a difficulty. So it does not happen without a proper team. So I must congratulate, and I'm proud to say that we have an amazing team here. I think because of which we were able to have some sharing to be done with you, and we have seen Shakti here, as she has also mentioned. So I would just take this opportunity before we move on to the next part of the session. And I would like to congratulate them, and I would also say that if we can make this understood and we can train them under able leaders, able clinical leadership program, if we have fellowships for doctors and nurses, which we are doing at HCG, I think that will make a huge difference, because skilled nursing and different sort of a skill and care is required day in and out to manage those cases. Thank you very much.
এটা বলছি অনেকদিন থেকেই হচ্ছে টাটা মেডিকেল